Welcome to the deep dive. Today, we're tackling a really common knee issue, especially if you're active, maybe a younger adult. It's called Chondromalacia Patellae.
Or sometimes patellofemoral pain syndrome, right? You hear both names.
Exactly. And, the goal here is to cut through the noise. We've got some great revision notes, and we just want to pull out the key stuff for you fast.
Yeah, let's boil it down.
Hmm.
So chondromalacia patellae. Basically, it's the softening and then the breakdown of the cartilage that sits underneath your kneecap, the patella.
Okay, softening and breakdown. What actually causes that? Is it like one specific injury or?
It's usually, well, multifactorial, not often just one single thing.
Right.
We can think of it maybe like OMAT. O for overuse, think repetitive bending like running or jumping.
Okay.
M for muscle imbalances. Weak quads, sometimes weak hips, can mess with how the kneecap tracks.
Ah, right.
A for abnormal patellar alignment, just how your kneecap naturally sits and moves. And T for trauma, like a direct hit to the knee, although that's maybe less common than the others.
OMAT. Okay, overuse, muscle issues, alignment, trauma. So someone who runs a lot, maybe hasn't kept up with their strength training, they might be more at risk.
Exactly. Those repetitive activities are a big one.
Yeah.
Also, general muscle weakness around the knee and hip, having had a knee injury before, definitely. And yeah, those anatomical things, like how your kneecap is shaped or sits.
So what's happening mechanically, like inside the joint?
Okay, so imagine your kneecap gliding over your thigh bone. If there's too much force, or the force is uneven, it puts extra stress on that cartilage underneath.
Right.
And that repeated stress makes the cartilage, well, first it softens, then it gets kind of rough, almost like frayed.
Yeah.
And eventually it can break down. Think of it like sandpaper on a smooth surface, wearing it down over time.
Okay, that makes sense. Now, knee pain is so common. How would someone, or maybe their doctor, differentiate this kind of pain from, say, other knee problems?
Good question.
Yeah.
Because, yeah, lots of things cause knee pain. With chondromalacia, the classic thing is pain at the front of the knee, anterior knee pain. It gets worse with things like climbing stairs up and down, squatting, or that classic thing of getting up after you've been sitting for a while, like in a car or at the cinema.
Right, the cinema sign.
Exactly. But you still need to rule out other possibilities, like meniscal tears, ligament sprains, maybe patellar tendinitis that's pain more just below the kneecap, and even early osteoarthritis, especially in slightly older people.
So, quite a few things to consider. How common is this condition, actually?
It's pretty common, especially in young adults and athletes. We don't have exact numbers for the UK. The prevalence isn't really known precisely. But yeah, patellofemoral pain is definitely a frequent flyer when it comes to knee complaints in those groups.
Okay, so what are the absolute key symptoms someone might notice? What flags should go up?
Number one is that anterior knee pain we talked about, linked to activities like stairs and prolonged sitting.
Right.
You might also get a kind of grinding or cracking feeling or sound in the knee. That's called crepitus.
Crepitus, okay.
And sometimes, maybe some mild swelling, but not always. Oh, and interestingly, it does seem to be diagnosed more often in teenage girls.
Huh. Okay. So if someone has these symptoms, what happens next? Do they need lots of scans?
Usually the diagnosis is mainly clinical, so the doctor listens carefully to your symptoms. When the pain happens, what makes it worse, and then they'll examine your knee.
Makes sense.
Imaging like x-rays or an MRI isn't always needed straight away. It's more to rule out other conditions if the picture isn't clear, or maybe if the symptoms are really severe or just aren't getting better.
Got it. And the treatment, what's the usual plan?
The good news is it's usually managed conservatively. Surgery is pretty rare for this.
Okay, that's reassuring.
Yeah. So the mainstays are activity modification, basically, easing off the things that really aggravate it for a while. And physical therapy is key.
What kind of physio?
A lot of focus on strengthening the quadriceps muscles, the ones at the front of your thigh, and also the hip muscles. The idea is to improve the biomechanics, how the kneecap tracks in its groove.
Right, improve the tracking.
Exactly. Pain management, too. Maybe over-the-counter pain relief, if needed. And sometimes things like orthotics, like shoe inserts or maybe a knee brace, can help support things.
And how do people generally do with this approach? What's the outlook?
Generally pretty good. Most people find their pain improves significantly with the right management plan, especially that targeted physio. They can usually get back to their normal activities.
That's great to hear. Are there any downsides if it's, ignored or not managed properly?
Well, yeah, potentially.
Oh.
If it's left untreated, it could lead to chronic persistent knee pain. It might limit what you can do functionally, and there's a risk the cartilage damage could get worse over time.
Okay, so definitely worth addressing. So just to recap, Chondromalacia Patellae, that's the softening under the kneecap cartilage, causes that front of knee pain, often worked with stairs or sitting, but usually gets better with things like physio.
That's a great summary.
It makes you think, though, doesn't it? With knee pain being so common, what other little aches or signals from our bodies should we maybe pay a bit more attention to?
Absolutely. It's a good reminder to listen to your body and get recurring issues checked out, before they potentially become bigger problems.
Definitely food for thought. And for anyone revising for the MSRA or just wanting more structured resources, do check out passthemsra.com.
And there's also freemsra.com for more resources.
Great stuff. Thanks for tuning into this deep dive, everyone.